The first soft tissue technique I would like to demonstrate for the knee and thigh area is called the hamstring spread. So what you would do for this technique is to have your patient supine and have them slide right to the edge of the table of the side of the leg you're about to treat. And then you're going to have them drop their leg right down off the table, and they can actually let their leg come away from the table as long as their hip joint mobilizes that well. And then you're going to get your fingers behind the hamstrings on either side. Remember, laterally you have bicep femoris coming down, and it is on the lateral side of the posterior fossa. Remember, the posterior fossa is the back of that knee joint. And the hamstrings come down and separate with the semimembranosus and the semitendinosus coming to the medial side of the knee and the biceps femoris coming to the lateral side of the knee. So when you put your fingers back there, you're able to, down in the posterior fossa behind the knee, feel that space, that separation. So get your fingers up into that space, and you're going to give a mild, from the gravity of the leg on your fingers, you're going to allow it to fall in there, and you're then going to give a mild distraction. Just be careful that if you feel a strong pulse under any of your fingers, you don't want to put a lot of compression on that popliteal artery as it goes down through there. So just be careful if you feel a strong pulse to move your fingers and not maintain that pressure on that popliteal artery. So basically, as you see, my hand is coming and supporting the thigh here, and I'm coming around though, and I'm getting in and feeling that bicep femoris, and then I'm getting the medial side. Now, I don't want to support the foot. I want the foot to just hang loosely. And now gravity is allowing this thigh and leg to fall into my hands, and my hands are now getting deeper into that fossa, and I am giving a little bit of lateral distraction on those hamstrings so I can spread them. This is called the hamstring spread. And basically, what I'm feeling for now that I have this position and I'm doing the treatment, this is the treatment, this is it. But what's important is what you feel and what you're monitoring. And you're monitoring how much congestion, how much tonicity, how much fibrosity do you feel. And as you maintain your hands here, you may feel that the tissue starts to soften. You may feel that the temperature starts to change. You may feel that the tissue starts to unwind in your hands. Try and quiet your mind, hold the tissue, be with the tissue, if you will, and let it show you what it needs. You may see that my hands, my movements, I am moving a little bit and following the tissue. What's very important here is I am following what I feel. The tissue is starting to move in a particular direction. I am not initiating that movement. I am monitoring. The tissue is alive. It starts to move. It will show you what it needs. Listen to it. Let it show you the way. And then you simply follow it, and it will unwind itself and come to a balance. And as long as you just listen and monitor and follow the tissue, now this tissue is nice and loose, no more congestion, no more hypertonicity. This leg is nice and supple, and the treatment is done. It might take as long as 20 seconds. It might take as long as 30 seconds. It might take a minute. However long it takes is up to the tissue, not up to the practitioner. The next soft tissue technique I would like to demonstrate for the knee, thigh, and hip is called the supine traction technique for the posterior tibia and iliopsoas. So by this name, if we're treating the posterior tibia all the way up through the iliacus and even up through the psoas, this traction that I'm going to be giving is going to not just be addressed to the knee, but it's going to be addressed all the way up through the thigh, hip, pelvis, and even into the low back. So what you typically do is have your patient supine, and again, have them slide all the way to the edge of the table, and then hang their leg, as we did before, and drop it down off the table. They also then, as long as their hip is able, allow them to abduct that leg away from the table a bit. Now this time, you definitely want their foot between your knees, your thighs, depending on how tall you are, but you want to stabilize their foot between your legs. You then are going to place your fingers and hands and cup behind the tibia, the proximal tibia. You notice last time I was up and trying to spread the hamstrings superior to the knee. This time I'm going to be inferior to the knee joint itself on the proximal tibia. And I'm going to, you could even interlace your fingers if you want, like this, or you can just grasp onto the posterior tibia. But the idea here is to stabilize the foot, go behind the posterior tibia, and then you would literally lean back. And you notice my body weight is leaning back, and I'm giving traction now, not just into this knee, but all the way up. And I'm feeling the traction, and I'm trying to feel the traction engage all the way up through the psoas muscle. And as you lean back, you can have a sense of how far your tension is having an effect. And then from there, once you've got your tension in a place and engaged, you wait, and you monitor, and you listen to the tissues of your patient. You quiet your mind, and you feel. And times you have to be patient in what you're listening for or monitoring for. But with time, you will feel that the tissues start to react to this tension. They may start to unwind in some way, and if they do start to unwind, it is okay to follow them. Not initiate, but follow. And then, when you feel a release, or if you feel like the tissue has softened, or if you feel that the tissue has become warmer, this treatment is typically held for anywhere from 15 up to 60 seconds based on what you're monitoring and feeling and if there's change happening. If you are feeling some change and that change has come to a balance and there isn't any further change occurring, that means you're done. And so you would stop the treatment and bring the leg passively back up onto the table, have your patient move back towards neutral, and the treatment is complete. The next soft tissue technique I'd like to present is the parasacral and gluteal area soft tissue treatments. And essentially these are a crossover into massage-like treatments. So basically the gluteal muscles are some of the large, gluteus maximus is one of the largest, thickest, most voluminous muscles in the body in this area. And also, remember the abductors, gluteus minimus and gluteus medius, attach up here on the ilium. And then also remember a number of muscles come into this area and into the parasacral area, here laterally on the sacrum. So this area can develop fibrosis, it can develop edema, it can develop congestion. And again, if we work on the knee and we don't address any of this proximal areas first, then we may move fluid from here, but it really has nowhere to go because it's going to get stuck in the thigh and it's not going to be able to move through the pelvic region up into the abdomen and back into the full circulation. So again, we want to make sure we address all of these areas that could be hypertonic and congested. So these parasacral and gluteal areas, pretty much you can just use your heel of your hand, thenar eminence, and basically a massage-like treatment. And you can use one hand over the other, like so. And you can also use your thumbs to get down into these attachments for the gluteal muscles. So you notice more of what I'm doing here is almost, massage-like, and it is. So you're just massaging these tissues and seeing if you feel edema or hypertonicity or congestion in these tissues and loosening it up. And that's pretty much the parasacral and gluteal area soft tissue massage to loosen the tissues. To continue moving from the parasacral and gluteal areas down through the thigh to loosen and do soft tissue techniques, again, to improve circulation and lymphatic drainage. One area you want to be focused on is that iliotibial band. Remember from your anatomy that that is a very thick fascial band, and you can get a lot of congestion built up around that area. So just to, again, massage this lateral side, you can, you notice, get your index finger and thumb and not squeeze in a way that's going to pinch and hurt, but just a massage-like motioning of the tissue up and down this area, and particularly moving from distal to proximal, and then proximal to distal. We want to loosen this entire area and encourage flow up and out of the extremity, again, into the core circulation. So you can do it this way and focusing on that iliotibial band. You can also, for the whole thigh, and not just focused on the lateral side, you can get your hands in a ringing-like motion. And so one hand might be on the lateral side and one hand on the medial side, and literally kind of moving and ringing the thigh, again, to move fluid up and out of this area. And as you work with your patients, you'll get a better idea of how best to do this and what best feels most appropriate way for you to be working with the tissues to move this fluid up and out. The final soft tissue technique I want to demonstrate for the lower extremity now, kind of as a whole, but also focusing on the lower leg, knee, thigh, pelvis, and even up into the core circulation, is pedal pumps. So we can use the feet as a pumping motion in order to get the entire body's lymphatics moving and draining. So one way to do that is to have the patient supine. You lay your hands on the dorsal surface of their feet and then pump those feet in a plantar flexion movement, in a rhythmic pumping fluid motion as you see here. And so what we're doing is encouraging motion, not just in the feet, but you'll notice her entire body is moving as I do this, from her feet, through her legs, through her torso, all the way up through her head. So this is a lymphatic pump technique that's going to help drain everywhere from the ankles and feet, through the legs, the pelvis, and up into the core. You can also do this technique with dorsiflexion in mind. So you notice the first way I did it was my hands were on the dorsal surface of the feet, and I was plantar flexing the feet. You can also do it by putting your hands, the heels of your hands, on the metatarsal area of the foot, and then dorsiflexing the feet in a pumping, rhythmic motion. And you would do this for 30 seconds to a minute, depending on how much edema and congestion you feel is going on in the person's tissues. Now, one other concept here I'd like to cover is when someone comes to you and has either knee pain, possibly ankle or leg pain, they may have shin splints, or they may have congestion in the anterior compartment of the shin, or if they're complaining of posterior leg pain, they may have congestion and adhesions in the posterior compartment of the lower leg. And if you remember with muscle energy, we have a technique called an isolytic treatment for muscle energy, where it is not a physiologic contraction of the muscles. What you do is you meet the person's tension, so it starts out as an isometric contraction, but then you, the practitioner, overcomes their force in a very lytic-like motion in order for and the whole purpose you're doing it is to break up adhesions. So, for the anterior compartment, if you believe there might be adhesions in here of either of the legs, you would do an anterior compartment isolytic muscle energy technique. So, I'm going to have Catherine bring your hands up into my, your feet up into my hands. So, nope, bring your tops of your feet towards your, towards your chest. There you go. So I'm going to match that, and now you keep resisting me pushing your feet downward. Right about there, a little less strong than that. That's about right about there. So now we are in an isometric contraction. But then what I want to do is overcome that with a quick lytic motion a few times, with the idea that if the interosseous membrane or any of the tendons of the muscles in the anterior compartment are adhesed, we're going to break that up. And again, this is a crossover to soft tissue techniques because it's breaking up adhesions, breaking up fibrosis, improving venous drainage, improving lymphatic drainage. And that's why we would be doing it. Now finally, we can do the same concept for the posterior compartment by pushing on the metatarsals. And now Catherine, push down and yes, right about there is fine. So again, I want to communicate with the patient how hard I want them to push so we can reach an isometric level of contraction. Once we've met that isometric level of contraction, I then, when I'm ready to do the lytic motion, simply overcome the patient's force in a lytic way in order, again, to break up adhesions in either the interosseous membrane or any of the muscles in the deep or superficial posterior compartment of the lower leg. So we have now covered both pedal pumps and isolytic treatment of the anterior compartments and posterior compartments of the lower leg.